Hello, I'm Scott Roloff, President of IntegerHealth Technologies. At IntegerHealth, we quantify healthcare outcomes for insurance companies and self-insured employers. By putting a dollar and cent value on each healthcare outcome, we drive down the cost for health plans and workers' comp programs while improving the quality of care. We have two ways of doing so. The first involves combining the medical and pharmacy claims with the medically related absence costs. The second uses just the claims. This video shows how we do it with just the claims and calculate the claims per healthy day, which is used by health insurance companies and TPAs, Medicare Advantage plans, multi-employer health plans, ACOs, and when we're looking at the dependents under an employer's health plan. Let's begin.
Claims per healthy day is a fraction. The numerator is the claims during the year, and the denominator is the number of healthy days during that year. This graph shows the average claims expense of 19 cardiac surgeons during a year. From the best, Surgeon 1 on the far left at $1,700 per patient, to the worst, Surgeon 19 on the far right at $11,100 per patient. We can't just look at the raw claims cost, however. If you ask any doctor why they cost more than another doctor, they'll always give the same answer. Because my patients are sicker, and sometimes they're right. If you have two patients with identical back injuries, one who is 20 years old and runs marathons, and the other who is a senior citizen, obese, has diabetes, and works in a cubicle all day, we know it's going to cost more and take longer to get the senior citizen better. So we have to adjust for that by assigning each patient a risk score, so that when we're comparing outcomes, we're doing so on a level playing field and filtering out the effects of how healthy or sick a particular patient was. This graph compares the raw claims costs to the risk-adjusted ones. It's the risk-adjusted claims that we'll use in our calculation, and these will be our preliminary numerator. Now we have to calculate the denominator, the patient's healthy days during the year, which are the 365 days in the year less the number of unhealthy days. Unhealthy days are days spent in the healthcare system, such as in the hospital or visiting the doctor, or at home in a non-functional state, all of which our algorithms can see in the claims. This graph shows each surgeon's average number of unhealthy days. Just like with the claims, we have to risk adjust these unhealthy days to level the playing field, and use the risk-adjusted unhealthy days in our calculation. We subtract each surgeon's average number of unhealthy days from 365 to get their number of healthy days. That's our denominator. There's still one more thing to do. To separate those surgeons keeping their patients healthy from those who aren't, we compare each doctor's unhealthy days to the group average, the blue line. For those surgeons doing worse than average, their column is above the line. We take the number of days over the line and add it to their numerators. This is the quality of life adjustment. It's the excess number of unhealthy days multiplied by the group's average claims per unhealthy day. We add it to the risk-adjusted claims to get our final numerator and divide this numerator by the denominator, the number of healthy days, to get the claims per healthy day. Surgeon 1 is still the best, and Surgeon 19 is still the worst, but except for a few others, the order has completely changed. When we re-rank the surgeons based upon their claims per healthy day, this is what we get. The green arrows show the doctors that moved up, and the red arrows those that moved down. Finally, let's compare all the surgeons to the average for the group, the green line. This really demonstrates the power of these analytics and the magnitude of the savings opportunities. If we took all the patients going to worse than average doctors, those whose columns are above the green line, and moved them to that average, not to one of the better doctors on the far left, but just to the green line, we could decrease our costs on those patients by 35% and increase their healthy days by 21%.
That's how we quantify healthcare outcomes using just the claims. There's another video that shows how we do it using the claims and the absence costs. If you're interested in either solution, I'd love to talk with you. My contact information follows.